A survivor story is meant to inspire us. We learn of their tragedy, self-doubt, and eventual triumph. But what about the story of an individual who has survived by cheating death 3 times? Well, RJ Wyndham is that person. His story is not only motivational, it is inspirational. Through the Patient to Patient podcast, you will be captivated and taken on a real survival adventure, meeting global experts and cancer survivors just like you, where no topic is out of bounds. Now, your host, RJ Wyndham.
Welcome to Season 1, Episode 5 of the Patient to Patient podcast. I'm your host, RJ Wyndham, and for today's adventure, you and I are going to travel to the United States and meet the amazing Dr. Susie Gronski. Well, the clock's ticking, so let's fire up the virtual rocket and head to the United States. To welcome Dr. Susie Gronski to the Patient to Patient podcast. Actually, having you here today on our program is going to make us that much more intelligent. So I know that you're a licensed doctor of physical therapy and an expert in pelvic rehabilitation. And to hear your out-of-the-box thinking when it comes to post-cancer surgery for men in the aftermath that follows is something that I've been eager for you to be on our program. So welcome.
Thank you so much for having me, RJ.
Oh, again, it's been my pleasure. So for many of us, there really is no specific roadmap when it comes to post-prostatectomy care and rehabilitation. Do you find that this is true as well?
I do, and this is extrapolated from the men that I've worked with over the decade that I've been doing this work, and also in the literature. At most, I think some men will get a handout, a one-page handout of how to do some Kegels. And That's about it. But there's no talk about, sexuality, sexual health, post prostate cancer diagnosis and treatment, what to expect, how to reintegrate a sexual identity post prostate cancer surgery or treatment, and also just working with the pelvic muscles themselves and nerve regeneration and rehab and penile rehab. And, there's no talk about all those things, pumps or toys.
Right, exactly. And we're going to get into that. I'm going to see if you can, answer a few of those questions and maybe debunk a few as it were. But the same thing happened to me. I'm actually currently in Los Angeles, and the big medical facility was where I had my surgery, and there was no roadmap. It was sort of you were the person that bought the new car, and so everyone was really nice and everything. And then after you drove away and came back for service, it's quite a different experience. And a lot of people that I talk to from the patient's point of view feel the same way. So I have a few questions prepared. Are you ready to jump into it?
Yeah, let's do it.
All right. So I know that there's a statistic out there that the patient has, I don't know, between something like 11 to 12 seconds before the doctor interrupts him. But what do you feel is the biggest concern that is not addressed before prostatectomy surgery?
The biggest concern would be regaining sexual function. And I would have to say that I think this is discussed, but very briefly as a side effect of potential treatment options. And honestly, when someone has a diagnosis of cancer, prostate cancer, the last thing on your mind is going to be, thinking about the sex or the incontinence issues that might occur, because this is a big deal and it's your life. And so the thing that you're probably thinking about is just surviving. What's my likelihood of surviving? Is this workable? So it may be discussed for certain in brief, but as far as having a plan or a recovery strategy to say, I know this might not be on your mind right now, but we have the support and the resources for you afterwards. So this is not going to be in the forefront at the moment, but afterwards, here's the support, here's the action plan. And that's what's missing is that action plan, the support as a community, community of men who've gone through these changes in their life, and also addressing the grief and loss around having a cancer diagnosis and then having the outcomes of the consequences of certain treatments.
No, I couldn't agree more. And although I was handed a kind of booklet, if you will, it was written by a urologist, and and the urologist saved my life, of course, but it was written in that kind of language. So leading up to it, you go, okay, I'm going to put this over here because I'm worried about not dying on the operating table, or being administered something improperly by the anesthesiologist. So all of these factors run through your brain, but you hit the nail on the head that there needs to be a roadmap. Post is the hardest for different men around the world, not just here in the United States, but I speak to people in all different parts of Africa, throughout Australia, throughout UK, and it's the same story over and over again. So my next question would be, what would be the best advice for male sexual recovery after prostatectomy surgery? Now, I know we touched on this a bit, but if you were to design a plan, a roadmap, where would you begin?
So this is a big question. I'm going to definitely, I have fun with this question, honestly, because there's so many angles that we can approach sexuality post prostate cancer. And it first starts with sexual health education to begin with. How there's a gap as far as what we're taught, both men and women are taught as far as their sexuality, how their sex organs operate and work, and all that entails as far as our sexuality, because it's not just the biological, but also the psychological, the social, cultural, and then the relational factors that are part of our sexuality and our experiences. So first thing first is empowering someone with knowledge, about how their bodies work, even before their bodies change and things happen as far as illnesses and other diagnoses and age and so forth. So, having that education up front. So that's what I do in my office is make sure that we have medically accurate education, anatomy, and physiology, so that the person understands how their body works, and then can feel comfortable to then start to explore other ways to regain sexual function, which is going to vary from person to person based on, of course, their diagnoses, the care that they received, even down to, the urologist or the surgeon and their experience and your prior health and so forth. So offering options, knowledge, options. The other thing is that I think is missing is just discussing prior sexual health function, prior relational factors related to sexuality, and how they, how the person basically identified themselves as a sexual being,
of course,
and talking about their experiences and how that has shifted and changed over the course of their life and also after cancer. So I think, again, opening the conversation around, what is the most distressing aspect of what has happened to you in your experience, and addressing the grief and loss that occurs through that process, and then helping that person find other ways to connect with themselves as a sexual being, because pleasure is limitless, and it may not look exactly the same, again, depending on someone's outcome, because it can take a couple years to see a regaining of sexual function. So, again, saying that to someone and saying, just because penis function isn't exactly the way that you remember it, and I know that's definitely distressing and frustrating to experience as a person, and how can we help you and or with your relationship and your partner to reconnect as a sexual being, to reconnect with pleasure, to find other ways to experience orgasm in different ways. So I think that is really important as far as having a conversation around and doing the sexual health counseling and education piece, which is often missing in a traditional medical care paradigm.
No, I couldn't agree more. And thank you for touching on all of those subjects. I vaguely remember in the conversations that I have with cancer survivors, globally, they hear nerve sparing, or they hear, different, words that are part of their vocabulary now, but yet you really don't know how you're going to end up after, the surgery itself. As you said, it could take, 6 months, a year, 2 years, 3 years. It just depends on the person and the procedure that they had. Now, one of my favorite topics, and I'm eager to hear your advice on this, pills, pumps, and pelvic floors, since we're now delving into your neck of the woods, if you will.
Yes. Where would you like to start, RJ? Because
Let's start with pills.
Let's start with pills. Yes.
With pills.
Well, while I don't prescribe them, however, I my role as a pelvic therapist and a sex counselor and educator is to really look at someone's list of medications, do my due diligence in looking at side effects, because if we're dealing with prostate cancer and treatment that is impacting sexual function, I really want the person to know if there are any other medications that they're on that are also influencing sexual functioning. So that's really important to know as far as pills. The other side of that is Viagra and Cialis. So traditionally speaking, men will receive Cialis, a low dose Cialis to take every day. And in my experience, men will often give up on the pill very quickly because they find that it's not working.
Right.
But what they don't understand is an accumulated effect over time. And it's often a combination of things that are going to help with regaining erectile function. Again, we don't know to what degree, but we're certainly going to optimize as much as possible by incorporating multifactorial treatment plan. So that may include pills or injections and also vacuum erection devices, so penis pumps that help with basically mimicking or nocturnal erections, because men will have upwards of, I've read it, 2,000 per year. So if we do the math, if I'm right, it might be 5 per night. So having a penis pump as part of penile rehab is really important, because you have to synthetically generate an erection to help with oxygenating the tissues, helping with minimizing any potential of scarring or loss of length, which often is a complaint as well, losing length of the penis. So we want to do a combination of that, and then also vibration, penile vibratory stimulation, using, vibrators and so forth, and other, sexual aids or toys to enhance, again, to help optimize penile recovery and sexual functioning. And then pelvic floors. So that's all part of the pelvic floor, because you've got muscles, you've got nerves. I don't know if your audience is able to view this video, but I have
They will. Yes. We have a YouTube channel and podcast. Audio.
Great. So here
Perfect.
I have a 3D model of a male pelvis here to show the pelvic muscles here, as far as the muscles around the base of the penis. So you have the bulbar cavernosus, the ischiocavernosus muscles, and the transverse perineal muscles here. And these muscles are very important as far as continence control, but also in sensory signaling, sexual functioning, appreciation of an orgasm, and then ejaculation as well. So very important as far as rehabbing these particular muscles, and not just the muscles that are deeper, which are named the levator ani muscles, but really honing in on the muscles that are actually around the parts that we need help with regaining function of post-prostate prostatectomy.
Absolutely. Now, I know that in the continent of Europe, they skip pills altogether and they go into trimix right away. So it's interesting to find out how different areas of the globe, treat, this particular rehabilitation for sure. And but a low dose on a consistent basis, from what I understand and has been the experience, with myself, has stimulated the nerves over time, and it's just part of a long rehab process. So my next question: what can men do post prostatectomy when nothing is working? Pills aren't working, pumps aren't working, injections, are very hit or miss. What would be your advice there?
So a very deep question, of course, right? Nothing is working. And so now what? What does that mean? Do I stop being a sexual being? I would argue no.
Absolutely not.
I would say there are many parts of our body, any part of our body can become erotic and erogenous. But we also have to be willing to take a different approach, right, to our sexuality and open the sexual menu or expand our sexual menu and repertoire as far as what that means for us as an individual. So this is very individually based, depending on that person, their willingness to expand this sexual menu repertoire. But you can still experience orgasm. You can still experience pleasure, if giving and receiving. And so I encourage folks to turn towards themselves as an erotic friend, an ally, and also turn towards their partner, if they're in partnership, of course, to turn towards their partner as an erotic ally. So you can certainly have a lot of fun and experience much pleasure. And like I said, and even orgasm, because orgasm and ejaculation are not the same. They're very parallel. And I understand, and while I don't have a penis myself, I work with many penis
Understand
havers.
the functionality of it.
Right. Yeah. So
perfect.
so knowing that, that this experience for a lot of penis havers is very parallel, two sides of the same coin. I orgasm and my sex organ performs and behaves in a certain way. And so there's an association there. Another interesting, I think, idea to plant for folks is this concept of perhaps a penis sleeve, or
that was where I was headed next. I call it Plan Z.
Plan Z,
when all else fails.
So or a strap, like a hollow strap on, or a penis sleeve that you can attach to your body and basically embody sort of like a prosthesis, right? You embody that part of an organ or that sex organ, and it can definitely be a very erotic experience because your brain will literally embody that device. Again, if you associate it consistently over time, it just like a prosthesis anywhere would, it becomes part of you. And you can actually experience, in fact, there's a case study that a restoration, it's called Restoration of Satisfying Sex for a castrated cancer patient with complete impotence, a case study. I don't know how I feel about the word castrated.
I know. It made me go up on the balls of my feet, right?
Right, yeah. It's from the Journal of Sex and Marital Therapy. Oh, I'd be happy to
I'll put it in the show notes. But because I've been searching high and low for that, because I've been asked this question quite a bit recently. And so that's when I call it Plan Z, when all else fails. But, the good news is that for your partner, it's now become a blank slate. So, someone's willing to start from scratch, be a little more in tune, and maybe they just forgot, so the partner can bring them back and they can start anew, so to speak. So, so I'm glad you talked about that, because that was one of the main points that, I wanted to discuss with you. And, so I'm happy to do that. So, all right. Well, fantastic. Now, so tell us about how our global viewers can find you and what programs that you offer or would recommend.
Yes. Well, thank you for the shameless plug. So folks can find me. Folks can find me at drsusieg.com. That's drsusieg.com. I'm also on YouTube and I'm on Instagram as well. So those are the three main places to connect with me. And you
Oh,
mentioned something
fantastic.
about a program too, didn't you? Oh, yes, my
I
sometimes
did. I did.
I do have an online program, but it's specifically for men who are experiencing pelvic pain. This may happen after a prostatectomy as well, certainly, or conditions like Peyronie's disease, where there's scar tissue that starts to change the penis shape and length, and that might actually be painful as well. And so there are many conservative ways to address that as far as penile rehab goes as well. So the program is the men's online pelvic pain relief program. It's a 13-week program that includes the expertise of a pelvic therapist like myself and also a doctor of nutrition. So we combine nutrition therapy with pelvic therapy to help.
No, that's huge, especially from all the different viewpoints, and that's why, I refer to it as out of the box thinking, because of the fact that there is no set rule, there is no this happens X, Y, Z, and then this and then that. So that's why, people like yourself that are doing this amazing work and coming up with programs for people. It's just so important. And I think, from 2020 on, we've all evolved into telehealth and, working at our own pace and, being able to view different courses that we could take, to help us at our own pace. And it's hard to get in the car and drive to where you are, or to drive to where someone else is, either on the East Coast or West Coast, but, or, as a lot of our viewers are, in Europe and, throughout Australia, they could take advantage of this. And so my final question is that I know that you've been working with men and that's your specialty. What advice would you give the partners of patients that are out there, because they suffer just as much as the actual, cancer patient themselves? So I'd be interested to find out, what advice you would have for a partner.
Yeah, that's a really good point that you bring up, is that this is a partnership, if they are in partnership, and how does a relationship impact each individual as a dynamic. And my best advice would be for the partner really is to, as I mentioned already, to turn towards your partner as an erotic friend and ally, if it's particularly around a sexual intimacy and sexual relationship, but also finding ways to empower your partner. Often there's a almost like a desexualization that happens of our partner because they have a chronic illness, or because their bodies have changed in some way, or they're suffering in some way, and the partner takes on this role as a caregiver, and then through that process, it almost like you almost desexualize your partner. And so I would encourage partners to acknowledge when that's happening, and to maybe take that caregiver role hat and put it off to the side to really start to reconnect with that person emotionally, sexually, and playfulness, and in ways that perhaps have been put to the wayside because of certainly very challenging circumstances. So, finding ways to empower each other, during this process, and not forgetting that both of you are sexual beings still, regardless.
No. It's well said. And I'm definitely going to invite you back, because we could spend a whole hour on that. And, I have something called unlocking the 5 keys. So maybe very soon I can have you back, and we can definitely dive deep into those topics.
That would be perfect.
Well, that's going to do it for our program today. And, thank you, Dr. Susie G. You made us all a little bit smarter today. So thank you.
Thank you for having me, RJ. It's a pleasure.
Okay. My pleasure. Thank you. Well, that's going to do it for us today. Be sure and check out the free resource section at rjwyndham.com. And remember, a journey is something you do on your own, but an adventure is done with loved ones and friends. Until next time, I'm your host, RJ Wyndham.
Thanks for joining the Patient to Patient podcast. If you enjoyed this episode, make sure to like and subscribe for free. If you know of someone that could benefit from today's show, make sure to share this episode with them.